All right, good afternoon, everyone. Time is now 11 minutes after 4. I call to order the meeting of the Health and Mental Health Committee for March 21st, 2023. A copy of the agenda for this meeting may be found on the county website under the tab for the legislature. Please silence your phones and electronic devices. And at this time, I ask you to please rise and join in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, welcome, everyone. We have up first today.
Ready?
Yes.
Emo.
Here.
Nagusaki.
Present.
Edwards.
Here.
Luhan.
Present.
Sutherland. Here. Hotel. Here. Tui.
Here.
All present.
Okay. First up, we have Rick Gold, County Attorney. You want to come on down?
Much better replacement.
Okay.
I don't know about that.
All right, first up, we have a request to authorize and approve, and I'm sorry, what's your name?
Carol Pierce.
Carol Pierce, that's right.
Deputy County Attorney.
Okay, Deputy.
So she's the one's been carrying you all this time.
All the time. It's almost been a year.
I apologize, I just want to have it for the record.
That's
Okay,
quite all right.
thank you.
Thank you. Good
Okay,
afternoon.
good afternoon. Welcome. First up, we have a request to authorize and approve the acceptance by the County of Orange of any and all funds received by opioid settlements to be used for the treatment, recovery, and prevention of opioid use disorders and any co-occurring substance use disorders or mental health conditions. This is legislative request number 069. Can I get a motion?
Motion. Good afternoon. The county is currently a plaintiff in a 5 current class action litigations regarding opioid settlements. This is for litigation for participants that cause damage to their malfeasance and the opioid crisis. These lawsuits are aimed at manufacturers, distributors, pharmaceutical companies, and pharmacy chains. We also intend to enter into 3 more against CVS, Walgreens, and Walmart. Each of the settlements have certain funds coming in. They have, some are one-time payments, some are structured payments over a numerous amount of years. And the different settlement amounts go to different restricted and approved uses, all of which are aimed at treatment, prevention, recovery, the criminal justice system, prevention, any kind of support in the community. And the county executive plans on using all of those funds for those purposes.
Great. Thank you. Do you have any questions or comments from fellow legislators? Not seeing any, call a question. All in favor, aye?
Aye.
Any opposed? Okay, unanimous. Thank you.
Thank you. Have a great day.
You too. All right, item 2B. Oh, no, that's the first. Jumping ahead here. Item 2, Darcy Miller, Commissioner of Social Services and Mental Health. Come on down. Yeah.
Hey, Kevin.
How you doing, Darcy? All right, first up, we have request to accept and appropriate funds awarded from New York State OASIS Office of Addiction Services and Supports for jail-based medication assisted treatment, MAT, services for inmates for the time period 1/1/23 through 12/31/23. These funds will pass through mental health to Orange County Jail. Orange County Jail is in current contact with WellPath to provide MAT services to inmates, treatment plans, and linkage to care upon release in the amount of $170,000. Legislative request number 055. Can I get a motion?
So moved.
Second. Chantel and Lujan. Okay, go ahead.
So as you know, New York State legislation changed, mandated that all local jails provide medication-assisted treatment for those who are in need. Our jail had provided Vivitrol for quite some time for those who were a month prior to release. They now provide all three options, so methadone, buprenorphine, and/or Vivitrol for those who are coming into the jail. We have a contract with our OTPS, our methadone clinic, run by Cornerstone. And this money came in through OASIS, through the Department of Mental Health, to support exactly that, the cost of those medications. So we have, with the help of our county attorney's office, an MOU with the jail, and this money passes through to them, and they've added to their contract with WellPath, as you described.
Okay, great. Any questions or comments from legislators on the committee? Not seeing any, call the question. All in favor, aye.
Aye.
Any opposed? Unanimous, and we move on to item 2B, request to accept and appropriate New York State Office of Mental Health, WOGI, Welcome Orange Geriatric Initiative Grant COLA increase for year one in the amount of $12,150. Additionally, appropriate any unused year one 2022 funding in the amount of $59,342.10 into the mental health's 2023 budget. This unused funding is due to contract with New York State not being finalized until July 2022. Therefore, the contract agencies cannot send all the funding within 2022. The total amount is $71,492.10. It's legislative request number 046. Can I get a motion, please?
Motion.
Sutherland. And was that Michael? And legislator Amo. Okay, go ahead, Darcy.
So the Welcome Orange Geriatric Initiative is a collaborative between the Department of Mental Health, Social Services, and Office for Aging, as well as a number of our community agencies. They do receive referrals, do assessments in the community, provide mental health and/or substance use services in the home for those who are qualifying populations. It's really excellent work. We have one of the best organized programs across the state, and they're recognized for the great work. I think Anne Marie's presenting statewide on the Welcome Orange Geriatric Initiative. I thought she might mention it, but she didn't today. But it's really good work. So those funds will be helpful.
Great. Any questions or comments? Not seeing any, I call the question. All in favor, aye.
Aye.
Any opposed? Motion carries. And we move on to item 2C. Request to appropriate the remaining balance of $37,360 in funds awarded from New York State Office of Mental Health to support a contracted engagement specialist. The original award was for $40,000 for project period 7/1/2022 through 12/31/2023, which was accepted through resolution number 280 of 2022. This is legislative request number 052. Can I get a motion?
So moved.
Second.
Okay, Darcy.
So this was a competitive application that we received these funding, and the specialist is a consultant who assists with connecting families and/or youth to mental health services across the county. So again, great use of these funds, and I appreciate having them put in our budget to be able to continue that work.
Okay, any questions or comments? Commissioner? Not seeing any, I call the question. All in favor, aye.
Aye.
Any opposed? Motion carried. All right, thank you. Bless you.
Thank you.
Item 2D, request to accept and appropriate funds in the amount of $941,150 from Columbia University. These funds are made available through the collaboration with Columbia University and the National Institute on Drug Abuse, NIDA, NIDA, to implement the Healing Community Study. The funds are to be used only to reimburse expenditures beginning 4/1/2022 and ending 3/31/23. Legislative request number 051. Can I get a motion, please? Al Sutherland. Okay, Commissioner?
So of these funds, $285,700 are actually personnel, mandated personnel, a project director, a data analyst, and a communications specialist. So one is one of our county staff, our director of chemical dependency services, and then two other positions are consultants. And then the rest of the funds will be competitively procured. So along with the settlement funds that Deputy County Attorney was just speaking about, we will be putting out a competitive RFP as soon as it's approved to the community. It will include the additional funds here, the $655,000 to go for community services for abatement of issues around opioid. The goal of this particular project is to reduce overdose deaths by 40%. We've talked about it at updates throughout the time of the work. So yes, so you're familiar with that.
Okay, any questions, comments? Any members? Not hearing any? Call the question. All in favor? Aye. Any opposed? Motion carries. Item 2E, request supplemental appropriation to the capital projects budget for retaining wall at 30 Harriman Drive. This project has been approved under the 2023 capital plan as proposed project number 80. Upon approval, a new capital project will be created in the amount of $315,000 bonding. Legislative request number 053. May I get a motion?
Second.
Lujan, Sutherland. Okay, Commissioner?
So we have a retaining wall between 30 Harriman Drive building and actually where the BOCES building is on Harriman Drive. And that wall is just deteriorated and it's causing water to come into the building, right, and causing damage in the building. So that will be repaired.
Okay. Any questions, comments? Not hearing any. I call the question. All in favor, say aye.
Aye.
Any opposed? Motion carried. All right, Commissioner, thank you for that. And
Thank you.
you can go into your update. That would be great.
So, it's funny, I couldn't remember. I don't think we mentioned the last meeting, but we did receive a dollar amount from New York State OASIS, 2.75 million that we received for 22 and 23. I'll be back here next month with a legislative request to accept that into our budget. It's again for abatement services around opioids. It is a one-time amount, and then we'll have continued funding as we do with our own settlement funds that we receive directly to Orange County. And we will be receiving funds over a period of time, similarly from the state for those opioid settlement funds. They also will be going out in the same RFP. So if you can imagine with the way these funds came in with such a large chunk coming in 22 and 23, we needed to project out how we would sustain whatever program we would put in place in the first year. And that has been done, has been prioritized not only with our department, with approval from the county exec's office, but also with our steering committee that we put together, of which Legislator Sutherland, it's called Janet, Legislator Sutherland was a member. And so those RFPs will go out and we'll be excited to be putting programming out on the street that we really hope is going to help connect people to service and save lives. Just want to give you you already received the update on the NIDA. We just talked about that. That draft RFPs out, that's your update for that work there. Monroe Woodbury has had their first meeting. We're looking, hopefully by mid-April, we'll be opening that satellite clinic over there. Goshen's part has been submitted. We're looking forward to the state's response on that. I did give an update. We met with Walk Hill Police Department. Although we've successfully placed Pierre in our Middletown Police Department, Port Jervis Police Department, they're working wonderfully together. The Walk Hill Police Department is looking for a social worker, so we'll be using some funds to put a social worker in the Walk Hill Police Department to do some ride-alongs with law enforcement regarding those with mental health and substance use needs. And just an update on our staff social work vacancies. When we started talking about it, we have 4 vacancies. We filled 2, and we now have 5 vacancies. So it's a struggle. But really appreciate HR. They're doing a wonderful job trying to take advantage of some of the New York State civil service waivers they've put in place. We're hoping to be able to hire staff social workers outside of testing. After a year, they would become permanent. So we appreciate that support, and we'll continue to recruit. We also, because the industry has gone to a hybrid model and to a virtual platform, we will be able to offer hybrid options for our new staff coming on. So that's a positive. Oh, and I did send you also the Healing Community Study. Let me just see what I sent to you. Has the media campaigns. And what I asked Doreen to send out to all of you is actually a notice of the latest healing campaign or media campaign. And if you click on the attachments, there are a number of options that you can use on your social media sites that are specific to Orange County, that are all ready to go. You just cut and paste them right there. And we appreciate the work the Healing Communities Columbia has their own marketing folks. So once we give them the information, they make them specific to the counties they're working in. And it's really has a lot of resource connected to those links on that document that you'll receive electronically.
Now, is that what I saw something, but it was saying to send in our social media contacts or something? Was that the one, or was I looking at something else?
You know, it probably was the one about social media contacts. Just see this one
We
here.
have
that-
like a community channel in Monroe.
Right. And see, it has right here the
That's-
campaign toolkit.
Yeah.
Right, that campaign toolkit, if you click on there, has so many different options, not only educational pieces, but social media ready notices.
Good,
So
good.
if you want to use those, that would be really great. And that's it.
All
for
right,
me.
great. Thanks, Commissioner.
Thank you.
Any questions or comments? No. Okay,
Thank you. Have a good afternoon.
you too. Hey. Next up, item 3, we have Lawrence Ledoux, Commissioner of Valley View Center, Donna Strecker, Director of Finance, Valley View Center, and Langdon Chapman, Commissioner of Human Services. Hi. Okay, first up, we have item 3A, request supplemental appropriation for capital projects budget to purchase scoop wheelchairs. This will be a new project not originally included in the 2023 capital plan. Upon approval, a new capital project will be created, $35,000 bond with legislative request 038. Can I get a motion?
Second.
Sutherland. Hotel. Thank you. Lawrence.
You should have a justification attached with the request. So this is for some new scoot chairs. We realized we were needing some additional ones. These chairs currently have 5 of them in stock, but we could use an additional 10 more. We could purchase 10 more with this amount of money.
Okay, great. Questions, comments? I see any, I'll call the question. All in favor, aye?
Aye.
Any opposed? Motion carries. Okay. Donna, if you want to go into the monthly Financials?
Sure. Does everybody have the updated December financial as of 3/16/23? You do, okay. I'm going to go over those results. Just so you know, the 2022 audit is underway. We've had the audit team on site a couple of days last week, a couple of days this week. All the entries have been posted to December 2022, with the exception of the post-retirement benefits and the pension obligation. Those are the only two outstanding entries, plus what other audit entries the audit team may come up with. There's been no change to the IGT funding. We're still at the 2.1 million. Lawrence had sent you all a correspondence from the Department of Health saying that they're still working with CMS, and they expect those payments to be released at some point in the future. If we do receive any of those funds, and it's before the audit closes, we will seek to accrue the income into 2022. There's been no change to the provider relief funding. Year to date, we received 3.2 million. On the other revenue, the public nursing home side, we've received 35.5 million. Personal services for 2022, we expensed a total of 20 million. On the contractual, we expensed 13 million. The indirect cost was 1.6 million, and employee benefits coming at 15.3 million, and a small amount of serial bond interest at 89,000.
More questions? Yes, Mike.
Thank you. Thank you, Donna.
You're welcome.
So just looking at how 22 stacked up to the year before, looks to me like, again, pre the OPEB, because the OPEB hasn't been booked, it looks like our expenses are up a couple of million and our revenue are down a couple of million. So it looks like we're going to do like 4 million worse than the year before. Am I in the ballpark there?
Well,
And again, that's assuming the rest of the IGT comes in.
right. If you look at right now, if you look at the disparity between revenue and expenses, the 40 million in revenue, right? And then you have the 50 million. So it comes out to like 9.3 million right now, the disparity between revenue and expense for 2022. If we receive the remaining IGT and it comes in as what we projected, that's going to reduce that 9 million by about 6. So that loss will come down to 3.
Okay, how much okay, all right. Okay, but still, it looks to me like a couple million at least worse off than the year before.
This has the 13 million posted, the paper entry, right?
Yeah,
for
but
post-retirement.
I've taken that
But
back
if you
down to
take
doing
that
apples to apples.
Your revenue is down 2.2, right, in 2022. So your revenue is down 2.2. And then if you look at employee benefits, because that year-end entry is posted in 2021, that's 13 million difference between 2022 versus 2021.
Right, well, the OPEB last year was 12.3, so if I back out the 12.3 from the 64.38 from last year,
Right,
that'll bring me down to about 52 versus the 50 this year, so about
Gotcha.
2 off. So that's why I was saying 2
Yeah.
on the revenue, 2 on the expense, 4 overall worse. So again, my problem is, I get it, I've talked about it on this committee many times, we're in a new normal here, I'm sure the personnel commissioner might talk about how we're going to get more people, but unless we get more people to get us back to the point where we can reopen units, bring people in, I just keep seeing the deterioration year after year. And if this is the new normal, at some point, we have to stop this from deteriorating. So that's just my point. And I don't know that we can do anything unless we bring employees in.
Correct. Essentially, yes. That's our number one priority,
yeah,
as it is with all nursing homes and hospitals, not only throughout Orange County and New York State, but throughout the country. It's the number one healthcare issue right now.
Okay, all right. Thank you.
And the next results we'll be looking at are February as of 3/15/2023. Much of our focus still is on year end. There is no change. There's no IGT funding yet. Other revenues so far through the first 2 months of the year, our performance is just under 5.6 million. Personal services is 3.4 million. Equipment, we have purchased 13,000. On the contractual side, we have earmarked for expenditure right now 3.8 million through February, and we've actually expensed $1 million. The indirect costs will not post until year end. Employee benefits, we're coming in at 2.3 million, and a small amount of serial bond debt at the 25,289,000.
Any questions?
So now I'll reverse what I just said before. It looks to me like this year, we've got revenues up about $500,000 over last year where we were. Except, am I missing, was there an extra pay period in here?
No, what you might not, what you're missing probably is that the revenues include 399,000 for the healthcare worker bonus.
And we didn't have that bonus last year.
Correct.
So
It's
essentially.
not really revenue, it's
So,
pay,
yeah.
it's the Medicaid.
It'll be
It came in our
reclassed.
Medicaid reimbursement to pay the health, for the healthcare bonus.
So essentially we're flat.
So we're
which
gonna
is
pay
good.
that revenue goes right back out and, we
Yeah.
pay that to the employees. So
Right,
it's
got it.
great.
Yeah, that's what you're seeing.
Thank you.
You're welcome. You're welcome. And if you turn to the next page, you'll see the analysis of bill days and pay source type. Lawrence and I were looking at this before the meeting. Mike, what you're talking about here is our census. So right now, our growing revenue hinges on being able to grow our census. And so we have, looked at many, many different options, and some of that included Lawrence making the decision to close 3 units. He has opened up the short-term rehab unit, and we were looking at our performance here. So if you look at Medicaid, we were billing, our population that we're serving is just under 80%. If you look last year for the same period, we were at 84%. Remember, we lose money on every Medicaid bed that we have. And then you can see our performance is creeping up on our short-term beds. We're coming in February at 10.19. Last year for the same period, we were at 8.76. And Lawrence and I were talking today. Right now, we have available to fill is 30 short-term rehab beds.
Right.
And he's feeling, if we can bring in more staff, that we should be able to grow the other rehab unit. There is a need in the community. And we're incredibly hopeful. That's our motto.
Despite everything that's going on, you have to be.
They have to be.
Yes.
They have to be.
If we don't laugh, we'll cry. So, prefer the laughter.
But the hope is on a good plan.
Yeah, exactly.
Thank you, Mr. Chairman. So our payer source mix actually is better off
You
by
see
about,
that,
by
yeah.
about 4 percentage points.
Yeah,
So is that translating to the bottom line for us?
it will. Yes,
Eventually.
it will.
Okay.
You see the census is lower, right? So February 2023, we're at 64.71. Last year, in February, we're at 68.40, right?
Right, so on the
But our,
one hand.
our mix
yeah.
is different. And the mix, Medicaid is paying us roughly $305 a day. On your short-term rehab beds, you get up to over 700 a day. So growing that census is really very important to us from a financial standpoint.
Has our, what is it, the CMI index has?
The CMI,
The
yeah.
CMI, has that increased for us over the previous time period? So
I didn't bring that information with me, but we get a report monthly and it's been
Yeah.
pretty stable. It hasn't,
It has been.
yeah.
We do the
Um,
full house, meaning Medicare and Medicaid. Medicaid pays
Carve
us
out the
just on
Medicaid
the,
piece, right.
Yeah.
right, on the Medicaid.
I believe it's
component.
been pretty stable. We can send that information to you though.
Okay, and I love the fact that you've got the graphs here with the 4 years. if you could have added an extra year, 2019 is the critical year because that's
I
pre-COVID.
can.
That's, I mean, that's where we'd love to get back to. And again, I don't know that I've said it over and over in this committee. I don't know that we ever will get to that point. This may be the new normal, what we see here, but if we had 2019 as a comparison as to where we were before all this occurred, where we've got downtrend year after year after year. Thank you.
I will add that on for the next publication.
Legislator Tortel.
You also add, like I just did it real quick, the percentage difference from year to year. Like I did on the bottom below. So from 2020 to 2021, we
Yeah.
were down by 9.57%. 2022, from 2021 to 2022,
Yeah,
7.5, and overall average of 16.72% less occupancy than what we had.
going from 2020. Yeah. I can add that.
Yeah, I didn't include 2023 because I'm only 2 months here, so I didn't even bother with that one.
Yeah. I
I'd
can
like to
add
see
that for you.
too. We could do that. Thank you.
Thanks, Tom.
Quick comment.
Yes.
And just to add, and I think everyone's aware of this on the committee, and we see the percentages going down by the percentages that Legislator Patel just talked about, but the potential residents are out there. We just can't bring them in, correct? This wouldn't be going down if we had the employees to take care of them.
Of course.
They're out there waiting to
Right.
come in and they just can't come in.
Correct. Yes.
Okay,
We have a waiting list for long-term
I
beds,
think it's over 50.
over 50 right now.
But most of them are Medicaid.
Correct.
Yeah.
You're taking the whole reaper, you know,
Right.
you're taking the whole reaper.
Right.
If you can bring them in, Mike, bring them in, but we're gonna lose $400 a day.
you're gonna bring them in and bring revenue, so you're gonna
Yeah, yeah.
cut your losses. It would be better if they weren't those patients,
That's, I
but
understand your point. I mean,
but
if you look at
it's
it,
better to have them than not to have.
that's the
I
unfair
think-
part about it is, you know, that differential
Yeah.
is crazy.
Well, I think the issue, you know,
We give the same care to both people. We don't ask what your care source is.
Correct.
They're in bed.
What about the?
the issue is it becomes an access to care issue in Orange County, which is a problem.
Yeah.
Right.
Yeah,
And then you have, you know, the hospitals, you know, can't get rid of all the patients because they can't get them all to nursing homes. And then there's a backup in the hospital and you may not get some of the services you need at the hospital, or you may be waiting for quite some time at the hospital. So that the issue is a access to care issue. It's real.
understood. What about the federal and the state progressing on higher payments? What are we hearing on that?
Well, we've been.
Higher reimbursement?
We've been advocating for a 20% Medicaid increase. We met with a number of state senators and assemblymen, and I wanted to thank Legislator Toohey, Legislator Ellers. Also, Legislator Fagione joined us in some of those meetings. The latest I've heard is, I believe the House or the Assembly and the Senate budgets have a 10% increase for Medicaid. It's better than 5. Even with the 20% rate increase, if we got 20%, it wouldn't fill the hole, but it's better than nothing.
What was your last increase percentage? And when, do you know?
I don't think it, well, there was an across the board that we got, 1.5
It
maybe.
was under 2%. I think.
Yeah, it was small.
So the 10 is not
1.5.
20, but certainly a lot better than what we've had in the.
Correct.
Oh,
So
correct.
obviously that's not finalized
No,
yet.
no, no.
So it was a bit, 20 was a big ask, but we, you know, one of the messages when we were meeting with the senators and the assembly members too was every nursing home needs to be rebased. You know, we're working off of
2007 cost. base.
2007 cost report. It's
There's been no
ridiculous,
cost
you
of
know,
living increase.
You know,
They eliminated the trend factor many years ago, and that was designed so that the Medicaid rate would keep pace.
Are hospitals in the same plane, same base, same playing field?
I'm not sure.
Their
about
reimbursement
their
system is
reimbursement
different.
system.
Yeah.
No, I think it's a lot different than, yeah.
Okay, thank you.
Yeah, Lawrence, one thing I just wanted to note too was that in those meetings, it was really bipartisan, you know, we were meeting with both leaders of both parties. And the main thing that they could both agree on was, you know, that it's a problem that goes across the board. Everybody is affected by it. So I mean, we were saying that, you know, if you can't come together on this, what can you ever come together on?
right.
And then there were some letters that they all signed on to and things like that. So hopefully that's not over yet. You go from 5 to 10 to maybe 12, 15, but I don't know.
I don't know, well, that'd be great, but we're gonna continue to do the advocacy on Valley View's behalf and, hopefully it'll be positive.
Thank you for you and Don and all your efforts too in that fight.
You're welcome.
Legislator Amo.
Just a quick point, if we could postpone it until the Commissioner of Health comes on. One of the questions you talked about the hospitals and the backup of the run, I suspect it's gonna have a financial impact on them because of DRGs.
Right.
If it's still around, it used to be, I think, the point is where you're paying for 3 days of inpatient care, and you can't discharge them. And so you gotta eat the cost of the bed for the next 3, 4, or 5 days until you find a bed for them. What, how are hospitals doing? Are they having problems too? It should be a function of the health committee to find out, maybe we need to address that, because we may have a problem with some of our hospitals in the county, and don't even know about it.
I suspect, like I said, I don't know hospital finances very well, but I suspect one of their main talking points was the inability to discharge residents back to either the community or to nursing homes. And to your point, how that negatively impacts them financially.
Michael, we'll be going into this next, but I just wanted to point out that along those lines, that Commissioner Pointer, will be heading up the Orange County Board of Health and getting that up and running soon. And it hasn't, I don't think it's been, have they been meeting during the pandemic? And
previous to the new board assignments there and the new commissioner, it hadn't been meeting for quite a while,
right.
even before COVID.
Yeah, so you know what, these are type of things that once Dr. Pointer gets this up and running, that's things that we can bring in. And the list of board members is very impressive from doctors from around the county. And you know what, stay tuned, right? Okay.
Just always remember DRG. Tattoo it drives the whole hospital healthcare system.
All right, we'll go on more into that when we get to Dr. Pointer, but Lawrence, would you want to go into your, or Donna, the Valley View update?
I sent that out to everybody. We talked about a lot of this already. We're going to talk about the attendance incentive in a minute.
Yep.
You have the updated COVID information and the census. We are undergoing an OMEG. If things can't get any worse, we're undergoing an OMEG audit, which is conducting an audit of the capital component of Valley View's Medicaid cost reports for the calendar years January 2015 to 2019. The Medicaid cost reports are the basis for determining the capital reimbursement component of the Medicaid rate. And the audit also includes a review of our capital appeal. So this is a normal occurrence across all nursing homes right now. The state is, looking to claw back money, and we're anticipating they will be clawing back some money from us as well. We don't know the totals yet, and the audit is not finalized, but obviously when it is, we'll report it back at this meeting.
Great, thanks. Up next, we have the attendance incentive for Valley View. I've asked Commissioner Chapman to come in from Human Resources to enlighten us a little bit about that, Commissioner.
Sure. I'll just jump into it and Lawrence add and subtract, divide, whatever I missed here. As I see it, from an HR perspective, Valley View's kind of got three distinct issues going on. You got staffing issues, you've got overtime issues, and you've got money issues, which are in part related to staffing issues and overtime issues. So and staffing is a national problem. So the feds have a website where you can look at different factors in different nursing homes, and Valley View has the best employee retention rate of nursing home employees. That was the most recent federal data on the Fed's website. So this is not a Valley View specific problem, as Lawrence and Don mentioned. It's really a national problem. We just don't have enough people going into the healthcare industry at this point to meet the standards and needs of what's really a growing service, nursing home care. So we've tried to kind of model ourselves a little bit off what the state did. The state gave an incentive up to $3,000 that a healthcare worker can earn over a period of between October of 21 and March of 24. And because we have an active CSEA contract up this year, we really tried to limit the time a little bit. So Valley View's patient-facing staff work 5 days a week. So that's typical work schedule here. So our incentive is really simple. It says, if you make your 5 days a week shift and Valley View overall on a month-to-month basis cuts its overtime by 50%, you'll get a $100 bonus that week. And that maxes out your opportunity to earn a bonus of $3,900 for the balance of this year. So it's a little bit different in the States, the opportunity to earn more money faster, but also links it to showing up and helping the facility as a whole. So it's not just me showing up, it's everybody showing up. So we're reducing our overtime. So we all
Fellow
get the
workers
benefit.
too.
That's right. It's a cooperative effort.
Yeah.
Collaborative effort.
Just-
Legislator Randall.
Question, maybe they know that for Landon, the ability to be out, I'm gonna say for like intermittent leave.
Sure.
How's that coming at Valley View? I mean, there's one of the reasons I understand at one point, the Family Medical Leave Act, which is federal law, we were having over 100 people were on it at one time. I don't know what it is today, and it's intermittent. And if you have that free access, your overtime is directly connected to it, I think. Can somebody help me with that? Are we still digging that deep hole, or are we out of it? We're moving on of it.
It's still an issue.
Okay, fine. I
And
understand.
the point of this, in addition to reducing overtime, I just want to get into some more specifics. This is, Langdon mentioned patient-facing staff. So this is primarily just for nursing staff. CNAs, LPNs, RNs, just nursing staff that are eligible for this bonus.
Okay,
And it's going to, the idea of it is to reduce overtime, number one. Number two, to reward those employees that come in as scheduled. So the difference between this incentive and the New York State healthcare worker incentive, the healthcare worker incentive includes sick time, vacation time. This is only for actual work time. Our attendance incentive is only for when you actually, if you're scheduled to work 37 and a half hours a week, you have to work those 37 and a half hours a week to be eligible for the $100 bonus. So we want to incentivize.
That's reduced by 50%. Running leverage.
Right.
How do you do
So,
that?
right. So we want to encourage more staff to come in when they're scheduled to work. And hopefully that'll reduce the overtime. It'll reduce having to mandate staff, and it, hopefully it'll improve the morale of the nursing department as well. So.
And just if you have a certain subset that come in 5 days a week, doesn't come down overtime by 50%, then everybody's out of luck.
They're out of luck, and we can terminate the incentive, as needed.
Okay.
That's it. We hope it's very successful.
Yeah, the caveat is that we do need this to go for a month, so we can compare, April 2023's overtime to April 2022's overtime. So there will be a month at least, where it needs to happen before we can start comparing and seeing how the overtime results.
Okay, I have a question.
I just want to follow up on just a question. Does the family medical leave, if someone decides to take a Friday off, intermittent family leave, they cannot complete their 5 days work? Is that correct?
This is incentive. Every single absence is counted
Doesn't
equally.
mean what reason you take it off for?
Doesn't
Doesn't
matter.
matter.
So if you say I want to take off because I feel sick on.
A vacation
Friday,
day, whatever, this is,
Okay.
the intent is to incentivize attendance and reducing overtime.
We can read between the lines on why it's Friday and Monday.
Well, no, the idea of it's from Sunday to Saturday.
Right, that's the.
It runs every week, Sunday to Saturday. And we don't want to encourage people not to take their vacation. People are entitled to the vacation, but if they miss this week, they start next week, right again on the Sunday. So, you know what I'm saying? So,
If you're
and then,
scheduled to work
Right.
5 days and you come 5 days,
correct.
They
you
can
will
get back on
receive a
track.
$100
Right, so,
bonus.
you have your vacation coming up. We don't expect people not to
No.
take their vacation. Take your
Exactly.
vacation and you'll be eligible for the next week. And so on, you get sick, that's fine. You'll be eligible for the next, you could start fresh the next week. That's the whole idea behind it.
And this was negotiated, that's
Right.
something that the county signed and the union signed
Sure.
and, I'll let you know, I certainly have the approval of the county executive and the chairwoman before we go do these things, and both were very engaged.
I'm going to take another question. Lori Montel.
Thank you, Mr. So it's indexed to 50% reduction of overtime from the same month the previous
The
year?
previous year, but also on a pro rata patient basis.
Say that
On a
last
pro
part.
rata patient basis.
Okay, I couldn't hear you. Okay, so how is it going to, we had more COVID cases this time last year, so how is that, how are you gonna balance that out? Because I think we had a lot more overtime last year than what I think you were anticipating for this year.
We were still pretty close.
Or you were-
The majority
okay,
of the overtime for Valley View, and I just brought some numbers with me. I just looked at 12/31/2022. Okay? So there's two components to overtime. There's regular overtime, right? And then there's straight overtime,
Right.
which is also overtime. So the CNA population, LPN population that we're talking about, the nursing population, in 2022, their overtime totaled $1.8 million. Okay? If you divide that by 26 pay periods, that's $144,000 per pay period. So we are looking for a high level, 50% reduction in that number, okay? And that is just for nursing. So I will, it's gonna take a little bit for the program to get off the ground. So we're, we'll be looking at it and we will report back as we measure the outcomes.
Thank you.
Okay,
Thank you.
take another question, Mr. Nagustakis.
Thank you, Mr. Chairman. Langdon, very promising program. Was it modeled after any other existing program anywhere in the state or the country? And if so, did they have results? And what were those results?
It wasn't exactly a model. We looked at different incentives out there, and there's different ways, different municipalities have handled this. So, the state's concept of here's, $1,500 over 6 months. I just felt you really need to do it on a more tighter basis so people can enjoy the benefits of it almost immediately, not have to wait.
Excellent. Were there any other programs that were trying to reduce the overtime and were they successful?
Not that I'm really aware of in terms of either way. I mean, we're kind of a, it's not unique because it's such a wrong word, but there's not a lot of situations where we have these problems that we've identified. We've got some significant problems.
Okay, good. Thank you.
Mr. Lujan.
Personally, I just want to say that I think this is really great. I'm glad that we're able to find a way to potentially save some money on the back end. So thank you for your work, engineering. I think that as we keep going back to this, and we've been talking about this for quite a bit, obviously, how do we try to solve, our hiring problem? That's the big elephant in the room, right? Like, what do you need from us to help you accomplish that? Especially when it comes to short-term rentals. Short-term.
I think we need, and if it was something that you could provide, I'd be on the phone and, I would say, I'd be calling you up and say, you need to get this for me, but it's not anything that you can provide. We need more nurses to graduate. We need more CNAs to, graduate from CNA class. It's really the bottom line. I think I sent everybody that information. The healthcare sector over the course of this pandemic has lost over 200,000 people. And at the rate we're currently hiring people, we're not going to get back to pre-pandemic levels until 2027. And there's issues everywhere you turn. Or SUNY Orange, I think we reported SUNY Orange doesn't have the professors to increase class size for nurses. So it's a multifaceted issue, and I wish there was a one answer or an easy answer, but there isn't, and that's why it's.
I think it was at a meeting yesterday that they were gonna be able to expand by 24 nursing students.
That's fantastic.
But it's limited.
That's a win, though. That's still a win.
It's a small
It's in
one.
the right
Small, but
direction.
we gotta take small wins. We gotta make those wins
Bigger.
incremental, right?
So my follow-up question, okay, we have a very limited pool of qualified candidates. What makes them go to Rockland, Dutchess, in terms of like the pay? And I know we discussed it. How are we competitive? in comparison.
We're very competitive in our attraction rates, in terms of attracting people to work for Valley View. It's just
Not enough.
the county attorney can't hire lawyers.
Yeah.
I mean, look, when I was county attorney, you got applications coming
All the
in
time.
left and right for lawyers, and, you can't, it's insane, this.
I've heard that as well.
We're taking a look at qualifications for jobs, and we're reducing them in many instances, so that if you send me a resume, Mr. Luan, that says, Bob wants to work for the county, and Bob's really qualified, but Bob doesn't quite have 3 years of experience in this, I'm gonna go, but he can do the job, let's take a look at these qualifications, so we're taking a hard look at all that stuff.
Okay.
But nursing is a different animal, because I can't
So
say, hey,
you need to have a license.
Yeah.
No questions.
Thank you.
Well, thank you, Commissioner.
Thank you all.
And, Don and Lawrence.
Program starts April 2nd, just so everybody knows the attendance.
Okay, April 2nd.
So,
Has it been communicated to the nurses? And
Oh, yeah.
what is their general feeling about it?
well,
Enthusiasm?
literally, the union had to be at the building yesterday for, some grievance hearings, so they drafted a memo, and they put the memo out yesterday. So there's questions there, and the union is also having some, meetings with the membership about it. So, and we're open to, to questions as well, to clarify any questions that they have.
Because
One of the first questions was, is FEMLA leave included, to be honest with you? That's the first question I heard, feedback that I heard.
Because I would think, I mean, they would have to be enthusiastic about it. The more enthusiastic the were, the more chances of success for the program.
Right.
I think the further way you get into it, don't you think that they're on track, they're gonna get more enthusiastic?
I think so. I mean, you would like to think that, a couple of our outstanding employees that show up every week, no matter what, start talking to their coworkers about this nice $100 bonus in my check, and then the $100 becomes 200 and so on and so forth. That's what I'm hoping.
And it's peer pressure,
The
it's peer
reciprocal
pressure
side
too.
would be if someone is missing,
Right.
missing, then they can be discouraged and say, oh, boy, I'm not getting it, but hopefully they'll always be optimistic.
Well,
Get back
that
on
person
track.
that may use, one sick day every couple of pay periods may decide not to use that. Yeah, so
Good. System.
if it's not really an emergency, if they're not really sick.
Great.
So
Okay.
that's the idea.
All right.
We are incredibly helpful.
All right. Well, thank you
Yep.
again. Great report and hang in there.
Thank you, appreciate it.
All right. Next up, last but not least, we have item number 4, Dr. Alicia Pointer, Commissioner, Health Department.
Thank you.
And I have Lisa here, but it looks like you're flying solo today.
I'm all by myself.
Okay, Doctor. We're going to start off here with item 4A. It's a request to create one public health investigator, venereal disease, Spanish English speaking, grade 14 position, as a stipulated position. It will be contingent on grant funding and will be automatically abolished upon the cancellation of such funding. That's legislative request number 014. Lujan. And second. Sutherland. Okay, go ahead, Doctor.
So this is a grant that supports expedited partner services in our sexual health clinics. We received extra funding from this grant at the end of last year, and we were able to create a new position. This would be a Spanish-speaking public health investigator based on where our clinics are located and our population. We feel like it's really important to have someone who can communicate with our patients.
Okay, great. Any questions, comments?
Just-
Legislator Lujan.
Thank you, Mr. Chairman. Just wanted to echo what I said in personnel as well. This is really an important step, particularly for the populations that we serve in Orange County. Really great to see that this is happening. I want to applaud you on your work.
Thank you. This is a goal of ours, is to have some more Spanish-speaking employees within the health department. Even in sanitary, so we can talk to our business owners, our restaurant owners. So we're really trying to make sure that we can, like I said, communicate with the people that we serve. So that's one part of this.
It's a huge step, and again, I applaud you, and this, but just so you know, it passed through personnel unanimously.
Yes, yeah, I saw that yesterday on the stream, the live stream. Any other questions, comments? Not seeing any, I call the question, all in favor, aye?
Aye.
Aye. Motion carries, unanimous, thank you. All right, we have item 4B. Request supplemental appropriation of year 2 funds into the operating budget for the period of 1/1/2023 to 12/31/2023. Funds are from the New York State Department of Health AIDS Institute for the Disease Intervention Services in the amount of $225,000, and its legislative request number 063.
Someone.
Sutherland? Okay, Commissioner.
This is year 2 of 5. This grant supports our AIDS investigations, diagnosis, treatment, and particularly linked to other services for people who are out of care. It pays for 2 staff, 2+ staff, and it's been successful. Year 1 was very successful.
Okay, any questions, comments? Not seeing any, I call the question, all in favor, aye? Aye. Any opposed? Motion carries. All right, item 4C, request to accept and appropriate funds from the New York State Department of Health for the Performance Incentive Initiative Award for the period of 1/1/23 through 12/31/2023 into the operating budget in the amount of $28,208, legislative request number 068. Can I get a motion?
Sutherland.
Sutherland.
I'll second.
Every year, the State Department of Health puts out this performance incentive. It's like a quality improvement incentive initiative. The one for 2022 was around the response to COVID and communication about a response to COVID. I can't really take any credit for this because most of this work happened before I got here, but this we are entitled to use on any Article 6 activity. It's not limited like a lot of our other grants. As long as we use it for Article 6 activity, it's our incentive initiative. So I'm proud of our team for helping us to get this last year. They tend to get an award of a similar amount every year in the same program.
So you'll keep up that tradition going forward now.
I hope so.
Good.
That's our plan.
Okay, any comments, questions?
And I'll say we're mostly using this for education, and we're also refurbishing a couple of our waiting rooms, particularly the one in Newburgh could use a lot of work.
Yeah. That's great to hear.
Things are going good over in the 1887 building?
They're going.
Any renovations or anything, or any additions? Not yet. All right, well, that's a different story for another day. Yes.
Just thank you, Mr. Chairman. Just a quick question. So you said that for the Newburgh office, so that will be to make the space more welcoming, or is it specifically more for the staff members?
No, this is for the waiting room specifically.
that's wonderful.
Yeah. So new chairs, a new paint job.
Wonderful. That's excellent. That
Yeah.
space, I mean, it definitely could use that.
It looks like a 1980s Catholic school detention room right now.
I'm
So we're gonna work on that.
glad it. You said it and not me. So
Yeah.
yes, it does actually look exactly like that. I was missing these, like the desk, like the small desk
Yeah.
one. Yeah. The only thing I was missing, and
Yeah.
detention.
Good.
Oh, really? Thank you. That was a great way to describe how that entrance looks. So I'm so happy for that.
Okay, any other questions, comments? Not seeing any, I'll call the question. All in favor, say aye. Any opposed? None. Motion carries. And we are on to the Health Department updates. Doctor, if you could bring us down that sheet, that would be good.
All right, so we'll start with infectious disease. flu has actually been stable. For the past few weeks, it's been slowly decreasing, but we're still down significantly from what we were at the peak. Still seeing, more flu B now than flu A, but significant decrease. Like I said, I think we're pretty much on the mend there. For COVID, our transmission level is low and our community level is low, which is wonderful. I have, 5.8 positive tests per 100,000, which is close to what we were last week, but those numbers are less than we've been for a very long time. And I mentioned that the federal public health emergency for COVID will end on May 11th. So we're starting to transition there. It will affect COVID testing for some people. It will affect COVID vaccines for some people, although it seems like the federal government is still going to be giving us COVID vaccines for now. And then we'll have other effects that we're trying to prepare people for.
And are we still doing some shot pods?
Yeah, I mean, we are occasionally asked by different communities to do them there, and so we've been doing that. We are also down nurses, so we'll be down 3 nurses in the next couple weeks. So probably starting in April, we'll only be able to do our vaccines that are currently scheduled and won't be able to do as many of those additional pods. But for now, we're still offering COVID vaccines
Where are
into
they?
our homebound seniors, stuff like that.
Where are those held?
So it depends who needs them. Our usual clinics where those held. So we have Newburgh and Middletown primarily. And then once we get our bus, which will be next month, we're
Great.
hoping, we'll be able to do them anywhere.
Right.
Yeah.
Okay.
Excellent.
For polio, the wastewater, go
Quick
ahead.
question about the bus. How many vaccinations will you be able to have on the bus approximately? Or how many will be able to get stored?
That's a good question. I'm not totally sure. I know that there are 2 exam rooms on the bus, but that's not to say we can't also do vaccines outside the bus and carry them on the bus. And I think we're having 2 refrigerators for vaccines on the bus, but I'm not sure how many that is.
Thank you. I just wanted to get it. Appreciate it.
Okay, and you're about to say polio.
So for polio, our wastewater has been negative since December 15th. The CDC is here actually right now as we speak, as is the State Department of Health, with members of our team and Ezra Swalem. We should be prepared that we anticipate to see positive polio in the wastewater again as the weather gets warmer.
Okay.
Last time I was here, you guys had asked about vaping and cannabis edible use. We do have presentations available for schools. We did a presentation at Yes Newburgh. The teens all really enjoyed it. They had a lot of really good questions. They said that they learned a lot, which is great. And we're available to do them for any schools that reach out to us. I know we've been in discussions with Minnesink a little bit about doing a presentation there. And then March is actually Vaping Awareness Month, and we have a social media campaign aimed at teens and also parents, just to make sure that people.
Do you have
know
any
about the dangers of
marketing
vaping.
materials on that, slides or anything that you're using? Some of our communities have, community channels.
Yeah, we have some really great stuff. So we have for our presentations, we have, I believe, like a webinar style presentation
You
and
have
also
something like
slides.
one type of, marches, maybe, I know we're getting down on the end of it, but I know in Monroe we can put it up for a couple.
Okay, yeah, we have a few really good ones that one of our fellows did. I can send it to you if you
Okay,
want.
if you could just send it to Doreen, and Doreen, if you
Yeah.
could send it out to all legislators.
Of course, yeah,
Okay,
we
great.
have one pretty good one for kids and one for parents that I can think of right now,
Okay,
and I'll send that out.
thank you. And medical examiner?
So we've been working really closely with the Department of Mental Health. We want to start an overdose fatality review board. We have a child fatality review board now looking at child deaths in the county. It would be something similar to that, to look at overdose deaths, why they occurred, and how we can prevent them. So that's something that we're excited about starting. And then we've talked about before some of our challenges with early intervention and preschool special education, especially with our shortage of providers. We met with the superintendents this past Friday to talk about what districts can do to support some of those efforts, including starting their own 4410 preschools, using some of their own providers, or having some of their providers contract with us. So that was very productive. And then we've been talking about, and I'll talk to you guys about this moving forward, considering an increase in payments for group preschool services to encourage group sessions where appropriate. So we still have a waiting list of over 200 kids. Some kids really benefit from individual therapy, but some kids benefit even more from group therapy. Kids tend to learn really well from their peers, especially when we're looking at things like speech and physical therapy. They want to follow what other kids are doing. Right now, our group payments steer providers away from group therapy, especially because if they have a group of 2 or 3 and 1 or 2 kids don't show up, they still get paid at the group rate, which is a lot less than they would get if they just had 1 kid to begin with. So that's one of the ideas that we've been talking about. There's also a provider conference at the end of April. We're really trying everything we can do to recruit providers to come to Orange County, to serve kids in Orange County, and to find ways to serve them outside of how they normally are. So looking at evenings, weekends, different locations. So we have a lot of things that we've been trying. We're throwing everything we can at this because, you know, we have these kids that are waiting, and we say, you know, early intervention is the best, and we, you know, we're missing them.
Okay, and then I see that you have a conference coming up.
Yeah, so that's our early intervention provider conference. That'll be Sunday, April 30th. And that's for our littlest kids, so our 0 to 3. And like I said, talking about how we can help them be more effective, be more efficient, see what they need, what kind of training they need, stuff like that.
And where will that be? SUNY Orange, I think?
It will be at SUNY Orange. You're right, yes. It was initially supposed to be at the emergency services, but I know their auditorium's gonna be under renovation, so it's to get moved.
Under construction.
Exactly, so it's to get moved to SUNY Orange, you're right.
Okay, great. And I just have one last thing for you. I know that you've been working to get the board together for the Orange County Board of Health. Do you need assistance with any of that? I think that when Betsy sent us some information on that, you would be the lead to start up, get a date. So if you wanted to see how that fits into your calendar for sometime in April,
I just need contact information
contact information for the other board members.
for the board members.
Okay.
Yeah.
Do we have that?
I can double check if you have it.
All right.
Doreen, can you send that to the commissioner and myself?
Yeah, I'm gonna see if I have phone numbers here. Yeah, I'll double check on
Okay?
Yeah.
Thanks. Then once you get
And then we
that,
can
maybe
start
pick
looking
it,
at scheduling.
then we'll talk, we'll find a date in April. And we'll get that up and running.
All right, sounds good.
All right, you're easy in. Great job.
Thank you.
All right, thank you, Doctor. That brings us to the end of our agenda. Can I get a motion to adjourn? You want to stay?
He's abstained. One of you in a second.